Well, it's time now for our Tuesday Health Report, and joining us now is Africa 54 Health correspondent Linord Moudou. I understand there is new information on flu vaccine.
Yes, Vincent, that's right. Researchers in the United States say they are closer to developing a vaccine to give lifelong protection against any type of flu. According to two separate studies published in Nature Medicine and in Science, the new vaccines generated strong immune system responses against the deadly H5N1 bird flu and the H1N1 virus in mice, ferrets, and monkeys. Studies are now needed in humans to confirm that the method will work. Now, the World Health Organization says people who delay or refuse vaccines for themselves or their children are presenting a growing challenge for countries seeking to close the immunization gap. Globally, 1 in 5 children still do not receive routine life-saving immunizations. An estimated 1.5 million children still die each year of diseases that could be prevented by vaccines that already exist. Vaccine hesitancy refers to a delay in acceptance or refusal of safe vaccines despite availability of vaccination services. A special issue of the journal Vaccine, guest edited by WHO experts, suggests ways organizations can increase acceptance of vaccines, share effective practices, and develop new tools to assess and address hesitancy.
People have a tendency to believe that the only reason of vaccine hesitancy is the fear of vaccine side effects. When actually, yes, this is certainly one of the major drivers, but there are many other reasons why people may be resistant to get the vaccine. And as examples of other drivers is the trust in the healthcare providers or in the healthcare system, potentially following the trend set by religious leaders or community leaders, the cost of the vaccine, and at times some geographic barriers when really the access to vaccine can be inconvenient to the populations.
And experts say vaccine hesitancy is an issue in high and low income countries and a complex, rapidly changing global problem that varies widely. It poses a risk to the individuals who do not receive the vaccine to prevent them from diseases and to communities, as some diseases can spread. Now, the growing rate of childhood obesity motivated the American Heart Association and Clinton Foundation to found the Alliance for a Healthier Generation. Over the past 10 years, the Alliance has coming up with creative ways to fight obesity, and one of these ways is allowing young people to be part of the solution. VOA's Faith Lapidus introduces us to one of the kids making a difference.
1, 2.
Jody Evans has always been active.
All right, guys, let's go.
She loves to exercise and play sports, including dancing.
Dancing is a sport. Not everybody thinks it's a sport just because it's just not in the Olympics. It's something that keeps your heart rate going. It's something that requires a lot of energy. It's something that requires eating healthy to have energy.
Grab your legs, rock back and forth.
Jody's healthy lifestyle and involvement in sports were among the factors behind her selection at age 9 to serve on the Alliance for a Healthier Generation's Youth Advisory Board.
They all are raising their voice on this issue. They're talking to their school board about changing out school food in the cafeterias, or they're planning a school garden, or they're talking to their state legislature about new policies they can pass.
Do you eat potatoes?
And more importantly, members are talking about healthier eating choices with their peers.
A salad, some hummus.
Which is crucial in order to change the current alarming obesity statistics.
1 in 3 children are overweight or obese. And some research out there suggests that this could be the first generation that doesn't outlive their parents.
I always kept in mind that I had to be active, and I always had to eat healthy.
Jody's gentle, friendly approach makes her friends listen to her.
She told me that our body is a temple, and we should take care of that temple by eating right, taking care of our body, exercising properly, and not overdoing it.
Though her term on the board ends this year, Jody says she will always stay active and continue to spread the message among her friends in school, her neighborhood, and everywhere. For writer Faiza El-Masri, I'm Faith Lapidus, VOA News.
Interesting young lady there. Well, that's our Africa Health Report for today. Vincent?
Very good. Well, thanks a lot, Linord. Now be sure to watch Linord Moudou's Health Reports every Tuesday and Thursday right here on Africa 54.